All right, good afternoon. My name is Dante Crespo. I'm here to perform bedpan, assist with bedpan. This is gonna be on a female. All right, so what I'm gonna do is I got my supplies. The supplies are gonna be the one barrier for the table, another barrier for the table. I have a chuck, I have a bath blanket, I've got gloves, and I have a bedpan. There's a couple articles that are going to be in the bedside drawer of the patient. That's going to be hand wipes, and there's going to be some toilet paper for the patient. All right, let's get started. I'm going to enter the patient's room. Knock, knock. Hi, how are you, Mrs. Jones? My name is Dante, and I'm going to be your CNA today. The reason why I'm in your room is I understand that you need assistance using the bedpan. That's correct? Oh, wonderful. Well, tell you what, I'm going to go wash my hands, and I'm going to gather the supplies. Before I go, I'm going to just make sure I have the right patient, Mrs. Jones. It is Mrs. Jones. I'm going to start by stating sanitizer washes hands, and I'm going to get my supplies. I enter the patient's room. I'm going to place my barrier onto the table.
When should I schedule it for?
Now I've got that here. I'm going to place my articles on top of the bedside table. I'm now going to close the curtains for privacy. Close the curtains for privacy. All right, Mrs. Jones, I'm ready to get started. What I'm going to do is I'm going to get your bed, and I'm going to raise it to my waist level because I want to make sure I've got good body mechanics, and her bed was at the lowest position prior. So now I'm going to raise it to waist level. All right. I'm going to start by getting my bath blanket. I'm going to put the bath blanket onto the patient. Without whipping it or snapping it, just going to go in and I'm going to fold it. All right. There we have it. All right, Mrs. Jones. Real quick, what you can do, if you can help, can you just hold this side of the bath blanket? That way I can lower your private and personal blanket down to your feet. All right. So, there we have it. You are covered up. The next thing I'm going to do, since your bed is at my waist level, I'm going to get my gloves because I'm going to place the chuck underneath your buttocks. Gloves are now on. I'm going to get my chuck. And place this right at your side. If you can go ahead and bend your knees and lift your buttocks. I'm going to lay down. I'm just going to get the other side here and roll this out. Remember, rolling towards you and rolling away. Rolling towards you is clean. Rolling away from you is dirty. Now, I'm going to get the bedpan. I have the larger side of the bedpan. This is going to go underneath the patient. The splash guard is always facing towards the feet or the foot of the bed. Okay? Again, if I can ask you to bend your knees. Bend your knees. And if you can raise your buttocks. I can place this right underneath you. So now this is in position. All right. Here you go, Mrs. Jones. I'm going to start coming in contact with her environment. So before I come in contact with her environment, I got to make sure my gloves come off. So I'm going to remove my gloves. These are going to go into the trash. I'm going to state sanitize his hands. That's my second hand wash. I'm going to go ahead and get the patient. I don't want to leave the patient flat on their back because it's uncomfortable. They're laying on a bedpan. So I'm going to go ahead and raise the head of the bed. Don't have to be specific with the angles of the Fowler's position, as long as you mention that the patient is going to be in a good raised Fowler's position. High Fowler's typically is 75 to 90, but as long as you just commit that patient to a comfortable Fowler's position, that's all that needs to be stated. The other thing I'm going to do is lower the bed. So in my previous video, this is the one thing I get getting questioned on, is that you're supposed to lower the bed? I did not state that in the last video. This one, I want to clear the air. I'm going to lower the bed. Because these beds are on crank, I sometimes get that eluded. Now, this is going to be the an automatic bed that is going to lower it. So I'm saying lowering the bed to lowest position. Because I'm going to leave this patient here for a little bit because I'm going to go on the other side of the curtain and I don't want the patient to be injured. So I'm going to place this now. You're ready. What I'm going to do is I'm going to get the barrier, remove that, place this barrier. I'm going to use this for right when I come back in. This is going to go into the soil linen hamper. The other thing I'm going to do is, where I said before, in their bedside drawer, I have their personal items here. You got your toilet paper and you have your hand wipes. Now, the patient does need to be able to reach this. So, can you reach this? Yes, you can? Wonderful. When you're finished, don't forget to wipe your hands, okay, with your hand wipes, okay? Be sure to wipe your hands. All right, so I'm gonna leave you for a second. I'm gonna be on the other side of the curtain. Here's gonna be your call light, just in case you need anything. But when you're ready, alert me, okay? I'm gonna be on the other side of the curtain. Patient is now, ring, ring, ring. Hi, Ms. Jones, I'm back. So what I'm gonna do now is get you all squared up, okay? I'm gonna begin by the first thing I wanna just grab is take this and clear the bedside table. I'm gonna place these back into your designated area. I am going to rapidly place the barrier back onto the surface. There we have it. So this is on the surface of the bedside table. Now I can come in contact with your environment again. I'm going to lower your head of the bed so that way you're laying flat. The other thing I'm going to do is once I'm done lowering you flat on your back, I'm going to raise your bed to waist level. Okay, so the bed was at lowest position. I'm raising the bed back to my waist level. All right, bed is at waist level. Now I'm going to come in contact with the undercarriage. So what I'm going to do is place on my second set of gloves. State standard, the state of California, the standard is 2 sets of gloves and 3 hand washes. But because of my infection prevention, I like to use 3 gloves changes and like 5 hand washes. All right, but just for those questions that come in contact, that you may come in contact with, if they ask you how many hand washes, the state of California is remember, it's 3 hand washes and 2 glove changes. I like to utilize 3 glove changes and like 5 hand washes. And this is why. Now I'm gonna come in contact with the patient underneath, right? So I'm gonna ask Ms. Jones, can you bend your knees and can you lift your buttocks? Okay, so now she's lifted her buttocks. I'm gonna get under here. I'm gonna make sure I get the bedpan and cover it up so that way there's to prevent splashing and spilling. Lowering the patient back down. This is gonna go, this is why I had that second barrier, because this is gonna come on top of the barrier. There we have it. Now, I need to come in contact with the patient's environment again. And I don't want to use soiled hands to touch everything. This is when this set of gloves come off immediately, okay? This is gonna go into the trash. States, sanitizes hands, that's my 3rd hand wash, right? I'm now going to say, Mrs. Jones, I'm gonna go ahead and ask you to, what I can do here, I can get this and place this right on top of you. And if you can hold that side of the corner of your personal blanket, that way I can bring this down. There we go. And now what I'm doing is I'm kind of rolling this into a ball, the bath blanket, underneath the sheets. And the reason is when I take this out, it's rolled into a ball versus just being completely untangled and coming in contact with my uniform. So I'm going to place this into its soiled linen hamper. I'm going to come back to the patient, making sure she's comfortable. All right, Mrs. Jones, I'm going to go ahead and get your bed. I'm going to lower it to its lowest position. I'm actually doing my ending steps now, my closing steps. I'm gonna put your call light in reach, make sure you're good. I'm gonna adjust your bed. Maybe you wanna increase, you want it a little higher? So there you go, I'm gonna raise your head of the bed, make sure you're comfortable. All right, we're set. Now, what I'm gonna do is I'll be right back. I'm gonna go ahead and get rid of these articles. That is when my third set of gloves go on. Because in the real world, patients' their bathrooms are centered, like, you know, attached to their room. And for a little moment there, I'm gonna leave the patient to go wash and dump this into their toilet. So, I'm gonna take this now with me. I'm gonna put this into its soil linen hamper. Because now I gotta go into the bathroom where I can't observe her. This is why I put the bed down as safety. So I'm gonna be back. Now I'm in the bathroom. Where I'm in the bathroom, I'm gonna go ahead and get this, throw this into the trash. This goes into the trash bin. I'm gonna go ahead and dump these articles, this content, into the toilet. Get a paper towel. I'm gonna turn on the sink, rinse this out, put that into the toilet, rinse this out, put it in the toilet. I'm gonna use that same paper towel to turn off the sink. That goes into the trash. This is gonna go into its designated area. My gloves come off. Gloves come off. This is gonna go into the trash. I'm gonna state sanitize his hands. I'm gonna enter the patient's room. That was my fourth hand wash or hand hygiene. I come back into the room. I'm now going to go ahead and make sure that the bed's still at lowest position. Call light is within reach. And I'm gonna now see if she needs anything. You don't need anything else? I'm gonna undo privacy. So privacy is undone. If you need anything else, let me know. Your table is gonna be right within reach if you need to place anything on it. And I'll be back, alert me when you do. Call light is there, all right? I'm gonna wash my hands, fifth one, and procedure's done. Task complete.